My name is Jennifer Bilk. I'm doing my head-to-toe assessment for health assessment class. I have with me Kyle, who has volunteered to be my patient today. Before this examination, I had Kyle change into a gown, which he's in. Empty his bladder. We did height and weight, vital signs, and we also tested cranial nerve number 2 using the Snellen chart, which his eyes are 20/20. Now, to begin this examination, we're going to first inspect the head and the face. The head appears to be symmetrical, the color appropriate for ethnicity. There's no noted rashes, abrasions, or lesions. No noted deformities that are apparent. And we're going to go ahead and palpate. Let me know if there's any tenderness, palpating the facial bones. No tenderness. Doesn't appear to have any irregularities with palpating the facial bones. The skull is symmetrical. Any tenderness? No. The scalp is symmetrical. The hair is coarse. It is shiny. Doesn't detach easily from the head. There's no noted areas of baldness, which is good. I'm going to palpate your sinuses. Let me know if there's any tenderness. No. Any tenderness? No. Okay. Frontal and maxillary, no noted tenderness upon palpation. I'm going to have the patient stick out their tongue. Good. Smile. Good. Puff out your cheeks. Squint your eyes closed. Good. Wrinkle your forehead. Good. This tests cranial nerve number 7, which is intact. I'm going to examine the eyes. The eyes are symmetrically placed on the face. I'm going to sclera is white. I'm going to look at the conjunctiva. Conjunctiva is pink. No noted nodules present or drainage or discharge. I'm going to palpate the lacrimal gland. Any tenderness? No. No tenderness noted. I'm palpating the lacrimal gland. We're going to test corneal reflex. These next following tests test cranial nerve number 3, 4, and 6. Look at me. Good. Blood reflex is good. The light shines equally on both eyes. The pupils are about a 4. With light shining on them, they go down to about a 2. They're consensual, which is good. I'm going to examine for consensual and direct. Direct. Consensual. Direct. Consensual. Good. They respond appropriately. They're both equal bilaterally. I'm going to have the patient look at my finger. Good. Pupils constrict when the object gets near, which is a good finding. I'm going to do the cover-uncover test, where the patient covers one of your eyes. Good. Cover the other eye. Good. Okay. That assesses for any extraocular movements, such as a lazy eye or nystagmus or anything like that, which was Kyle was negative for. His eyes reacted equally and did not have any extraocular movements. I'll take that back from you. We're going to check his peripheral vision field. Cover one eye. I'll cover the same. Tell me when you can see my finger.
See it. I can see it. I can see it.
Good. Cover your other eye.
I can see it. I can see it. I can see it.
Good. Peripheral vision is perfect. His peripheral vision is equal to my peripheral vision, which is good. I'm also going to check Rosenbaum, which checks for nearsightedness. In this instance, we would have a Rosenbaum chart, and he would hold it 14 centimeters away from his face. You would read the line that was he was most able to read, in which case we did earlier, and he had great near vision. We're going to check for any extraocular movements. We're going to do this by having the patient follow my light. Okay, follow the light. Good, 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 good. The eyes did not have any extraocular movements, which was good. Okay, I'm also going to check cranial nerve number 5, and I'm going to do this by having the patient discriminate between light, sharp sensation and a dull sensation over the face. Close your eyes.
Sharp. Dull. Sharp. Dull.
Good. The patient responded appropriately, which means that cranial nerve number 5 is indeed intact. Now we're going to look at the nose. The nose is symmetrical, it's even, the color is appropriate for his ethnicity. It doesn't appear to have any deviations, nodules, or lesions. No noted rash. We're going to look up the nose. Thank you. Good. The nasal mucosa is red, which is good, determinates they're red. And there appears to be no drainage or discharge, and they're equal on both sides. And the septum is straight, with no apparent deviations. Septum's larger in the posterior versus the anterior, which is a normal finding. Now we're going to check for patency. I'm going to have a patient close one side of your nose, breathe in, out, in, out. Patency is intact on both nostrils, which is good. At this point, we could check cranial nerve number 1, which would check for sense of smell. We'd have the patient close their eyes and have them identify the object based on smell. This is not usually tested in an examination, and therefore we will forego it. Looking at the ears, we see that the ears are symmetrical. They're midline according to the outer canthus of the eye. They're symmetrical on the placement on the body. There appears to be no nodules or rashes or lesions. We're going to palpate the auricles. Any tenderness? No tenderness noted. The auricles feel symmetrically. There's no nodules. We're going to go ahead and look at the tympanic membrane. The tympanic membrane is a pearly gray color with easily identified landmarks. There's no noted serum on that ear. Tympanic membrane on this ear is going to be a pearly gray in coloration. Landmarks are easily palpable and serum is slightly present, which is not an abnormal finding. We're going to examine the mouth. The lips are symmetrical, they're pink in coloration, there doesn't appear to be any ulcerations noted. Can you go ahead and open up your mouth? Good. Okay. The hard and the soft palate has normal coloration. There doesn't appear to be any abscesses, lesions, or abrasions noted in the oral mucosa. The coloration is pink. The teeth are intact, does not appear to have any cavities or abscesses. Can you stick your tongue out and say ah? Good. You can go ahead and put your mouth. The posterior pharynx is light reddish in color, which is a normal finding. There doesn't appear to be any ulcerations or drainage noted. The tonsils are absent from a tonsillectomy previously this year. The uvula is midline, with the upper portion of the uvula being resected on the left side due to a partial uvula resection earlier this year. I'm going to have you stick your tongue out again. Good. Can you move it from side to side? This checks cranial nerve number 12, which is intact. And we're going to look under the side of the tongue. Good. And that side of the tongue. Good. There doesn't appear to be any ulcerations or lesions present, which is a good finding. Cranial number 9 and 10 were tested here when the patient said "ah," and you can also test it by testing the gag reflex, which we'll not do on this examination. Now we will go ahead and inspect the neck. The neck is symmetrical, doesn't appear to have any deviations, rashes, or nodules. I'm going to go ahead and palpate the trachea. Trachea is midline. Doesn't appear to have any nodules or deformities noted. I'm going to palpate for the thyroid. Swallow. Good. The thyroid is palpable. It does not appear to have any nodules on the thyroid. We're going to palpate the lymph nodes posterior. Carotid, tonsillarily, submandibular, submental, occipital, superficial cervical, deep cervical, post-cervical, and supraclavicle and supraclavicle. Good. Does not appear to have any nodules present. Did you have any tenderness in
No.
palpation? No noted tenderness when palpation. I'm going to auscultate. I'm going to palpate the carotid pulse one side at a time, which is good. Regular rate, regular rhythm, regular rate and rhythm, which is symmetrical. Now I'm going to auscultate the carotids for bruit. I'm also going to auscultate the thyroid for bruit. No noted bruits, which is a good finding. Okay, I'm going to go ahead and examine your back. If you could jump down for me and remove your shirt. Okay, the back of the patient is, the skin is clean, dry, and intact. It's appropriate for ethnicity. Um, there appears to be no rashes or lesions noted. There's a small macula, slightly raised brown on this side, with regular edges. The patient does have a back tattoo that extends and covers the whole entire back. We're going to palpate. Let me know if you have any tenderness.
No.
Okay. The patient does not have any tenderness upon palpation. We're going to palpate the spine and make sure that there's no deviations. No deviations. Good. I'm going to do tactile affirmatus at say 99. Good. Tactile affirmatus along the lung field, the vibrations are equal. We're going to percuss. Percussion is resonance throughout the lung field. Now we're going to check for diaphragmatic excursion. And to do that, I'm going to have the patient take a deep breath and hold. All right, let out. Good. You can go ahead and breathe normally. Diaphragmatic excursion is about 3 centimeters, which is a normal finding. You can compare that bilaterally to each side. I'm going to have a patient sit up straight. I'm going to have the patient take a deep breath. Good. And relax. Good. Expansion was normal, symmetrical. The breathing rate is normal. He does not appear to have any difficulty breathing. We're going to check for CVA tenderness. Let me know if you have any tenderness. Any tenderness?
No.
Any tenderness? No tenderness noted. We're going to palpate the kidneys. Good. And let out. Good. Kidney was not palpated. And take a deep breath. And let out. Good. Kidney was not palpated. Okay. I'm going to listen to the lung fields. Deep breath. Good. Deep breath. Deep breath. Deep breath. Deep breath. Deep breath. Deep breath. And deep breath. Good. Auscultation is clear bilaterally. Okay, I'm going to have you go ahead and turn around. That concludes our posterior examination. We're going to move to the front examination. The skin is clean, dry, and intact. There appears to be no rashes, lesions, vibrations noted. The patient does have a chest tattoo and bilateral nipple piercings. We're going to go ahead and palpate. Any tenderness?
No.
No noted tenderness. We're going to do tactile affirmative, say none.
None. None. None. None.
Good. The vibrations were equally felt bilaterally. I'm going to feel for a heave or pulsation or a thrill. No heaves or thrills noted. I'm going to percuss. Dullness was noted over the heart, but resonance noted throughout the lung field. I'm going to listen to the lungs. Deep breath. Good. Deep breath. I'm going to listen to the heart now. I'm going to listen with the diaphragm and with the bell, standing up, laying down, and then also on the left side. And palpate the apical pulse. Palpate at the fourth intercostal space, top 1 line. And does not have any palpable thrills, but is easily palpable. I'm going to have you go ahead and lay on down for me. Okay, and again, I'm going to listen with the diaphragm and with the bell. And with the bell. Good. And I have a patient lay onto their left side. And listen again with the bell and the diaphragm. Okay, good. Now I'm going to use our pulsation. The abdomen appears, skin is clean, dry, and intact. There appears to be no rashes, lesions, or abrasions. I'm going to go ahead and auscultate. Positive bowel sounds in all 4 quadrants, and then listen to the aortic, renal, iliac, and femoral arteries. Okay. No noted bruise present. I'm going to do light and deep palpation. Tenderness.
No. 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 No.
Palpate the liver. Take a deep breath in and out. Liver border is easily palpated. Good. And the spleen is not palpable. And palpate the kidney again. Out. Not palpable. And not palpable. Good. All right. I'm going to percuss. Resonance noted over all the abdomen. Go ahead ahead and have you sit on that. Upper extremities are, we're going to compare them equally, or together. They appear color appropriate for ethnicity, hair distribution even, hands are symmetrical, cat refill is good, pulses are equal bilateral, brachial pulse equal bilateral, any pain or tenderness,
No.
no movement nodules or deformities noted upon palpation. We're going to test range of motion. I'm going to have you stick your arms out. Good. Press up on my hands. Good. Press down on my hands. Good. Bring your arms in front. Push my hand away. Good. Pull my arm. Good. Range of motion is intact. We're also going to test neck range of motion, which will test cranial nerve number 11. I'm going to have you shake your head yes and no. Good. And push against my hand. Push against my hand. Good. Cranial nerve number 11 is indeed intact. We're going to do examine the legs. The color is appropriate for ethnicity. Hair distribution is even. We do have an abrasion and some scars bilaterally on the feet. Color is appropriate. Cap refill is good. We're going to check popliteal pulse. Good. Popliteal pulse, which is good. Dorsal medius and posterior tibial, which is good. We're going to check range of motion. I'm going to have the patient push up on my hand. Good. Push up on my hand. Good. Bring in. Good. Push up on my hand. Good. Push down on my hand. Good. And check the legs and the feet. The strength is equal bilateral. No noted weaknesses. On palpation, there was no noted deformities. Okay. I'm going to check reflexes. I'm going to do brachial and ulnar. Good. Good. And relax. Good. Good. And then the knee. Good. And the knee. Good. And then the Achilles, which I'll relax. I'll hold your foot. Good. 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 I'm going to check the mid teeth. Good. And the mid teeth, which is good. You can check your spine properly. We are also going to check cranial nerve number 12, which is hypoglossal. I'm going to have a patient swing their tongue from side to side. Good. Cranial nerve number 12 is intact. Our general inspection, I forgot to do this in the beginning, but our general inspection is that we have a 20-year-old young adult who appears to be in healthy condition and in no acute distress. This concludes our examination. Thank you.